Okay, photography basics. Let's turn, my mic is going on, there we go. I shoot with a SLR. I think, first of all, just looks bad if you have a point and shoot, okay? Just don't use your iPhone. It also gets better photographs. I shoot in manual mode. How do you know what manual setting you should use? You're just gonna adjust for the right settings based on either a metering system, or you're just gonna play with it until you get the right exposure. Now, how can I do that? Because I have a dedicated room. If you've got variable light situations, like you're in a hallway where there's light coming in and out, that's going to prove to be a problem. So you really want to have a dedicated room as best as you can try to accommodate that design. The lens is recommended if you're using a crop sensor and not a full frame, 60 millimeters. To be honest with you, for me, the 105 millimeter is actually preferred based on my distance of my room. I get better images with it. So those are just some basic designs. For the room itself, the way it's designed, I've got these components, a door that automatically closes. I do not want any ambient light in this room. It's so important to have no windows in the room because there's so much variability in lighting. Lighting is the #1 enemy that you can have, or the friend here. Peephole, so that, I hate to say for the most least statuesque individual, that they can peek through there so that we don't slam open the door. And also the room size is uniform. I'm building another room right now. I'm expanding my office next month, and I'm making the next photo room with the exact same parameters, so the lighting, everything is the same. Also, I have a backless rotating stool, preferably with no wheels so that things don't roll around. And I also have a standardized blue wall with the PMS code recorded. So I try to keep everything standardized. I have numbered positions so that the patient says, I say turn to 1, 2, 3, 4 on the walls, so that everything is as standardized as possible. I have a computer workstation to transfer photographs and display photographs. I have even fluorescent lighting, and I don't use flash, and part of the reason is I do a lot of facial work and I want to be able to show shadows, and flash sometimes absorbs that. But I set the camera color balance to fluorescent light so it doesn't, the patient's faces don't come out green. So this is just showing some standardized lighting, standardized photography. What does that involve? No excessive hair products, same hairstyle if possible, no smiling if possible, although sometimes I don't always have that perfect. No head tilt. What is a Frankfort horizontal plane? It is defined as the inferior orbital rim up to the porion, which is the top of the tragus or the top of the ear canal. So teach your staff to do that. On the side view, you can see the same thing. Okay? Now, and the other lesson too is if the person does not follow these rules on the pre-op, try to match the post to the pre. That way they look the same, and that's also, so no neck turning. Frankfort horizontal plane. The neck turn means a lot of times what happens is there's like a tendency to do this. Try to have the whole body rotated to the side, whole body turning, have them turn each direction. So same thing on the other side. You can see this is actually not exactly standardized. I wish the nose was exactly to maybe the edge of the cheek, but this is as standardized as possible. For hair, it's not quite as rigorous because you're not looking at facial features. Then I do, these are the ones that are unique to hair that I don't do when I'm doing facial work. This is the back side, and then back looking up toward the ceiling, and then down. So those are all the angles that I have. Those are the 3 unique angles to hair, is the back up and down. And then obviously if you're doing scars or close-ups or eyebrows or facial stuff, you can modify that. I like the saying that the only photo you regret is the one you did not take, and that's absolutely true. So I try to get as many photographs as possible, because you're like, oh man. And especially the other good saying is you only have one chance to get a good before photograph. But when the person comes back to your office and you're wondering, should I go and take the after photograph? You should do it. And the reason you should do it is they may not show back up in your office again, and you need documentation every time you see them if possible. I photograph a patient practically every time I see them. I think unless they came in the week before or something. So that is photography.